Vulvar cancer affects the outer part of a woman's genitals, the vulva. The vulva includes the labia, both outer and inner lips, the clitoris, and the opening of the vagina. Vaginal cancer, on the other hand, develops inside the vagina, the muscular tube connecting the uterus to the outside of the body. Both of these cancers are relatively rare, with vulvar cancer being more common than vaginal cancer. They are typically diagnosed in older women, but it's important to remember that any woman can develop these cancers at any age. Early detection is crucial for successful treatment of both vulvar and vaginal cancers. Regular gynecological checkups and being aware of any changes in your body are essential for early diagnosis. If you notice any unusual symptoms or changes in your genital area, don't hesitate to talk to your doctor. Remember, knowledge is power, and understanding these cancers is the first step towards prevention and early detection. While the exact causes of vulvar and vaginal cancers are not always clear, there are certain risk factors that can increase a woman's chances of developing these diseases. One major risk factor is infection with the human papillomavirus, or HPV, a common sexually transmitted infection. HPV is associated with several types of cancer, including cervical, vulvar, and vaginal cancers. Other risk factors include smoking, a weakened immune system, and a history of precancerous conditions of the vulva or vagina. Age is also a factor, as the risk of developing these cancers increases with age. It's important to note that having a risk factor doesn't mean you will definitely develop cancer. It simply means your chances may be higher. Maintaining a healthy lifestyle, practicing safe sex, and getting regular checkups can help reduce your risk. Being aware of the symptoms of vulvar and vaginal cancers is vital for early detection. The most common symptom of vulvar cancer is persistent itching or burning in the vulvar area. Other symptoms can include skin changes such as thickening, discoloration, or sores that don't heal. Vaginal cancer often presents with abnormal vaginal bleeding, particularly after intercourse or after menopause. Other symptoms may include unusual vaginal discharge, pain during intercourse, or pain in the pelvic area. It's important to remember that these symptoms are not always indicative of cancer. They can also be caused by other, less serious conditions. However, it's crucial to consult with your doctor if you experience any of these symptoms to determine the underlying cause. Diagnosing vulvar or vaginal cancer typically involves a pelvic exam, during which the doctor will visually examine the vulva and vagina. If any abnormalities are detected, a biopsy may be performed to remove a small tissue sample for examination under a microscope. Treatment options depend on the stage and location of the cancer, as well as the patient's overall health. Surgery is the most common treatment, ranging from removing the tumor and a small margin of healthy tissue to more extensive surgery if the cancer has spread. Other treatment options include radiation therapy, which uses high-energy rays to kill cancer cells, and chemotherapy, which uses drugs to kill or slow the growth of cancer cells. Your doctor will recommend the best treatment plan based on your individual circumstances.